I'll get physical withdrawal symptoms.
Can you describe those for me?
I get the shakes. I get palpitations. And just feel very edgy, very sort of jittery. And I know that, the only way, or so far the only way that I can sort of stop all that is by drinking. So it's not so much that I want to, it's probably I need to. I don't know, I want the way I feel to end now. I don't want to feel like this anymore.
The plan is she's going to come in for a period of 7 to 10 days for an inpatient detox. And then it depends on how depressed she turns out to be. Very importantly, there'll be an outpatient plan following that, and that's yet to be determined.
Those are other rooms for the other patients. I would take you to...
It takes about 7 to 10 days to physically detox from alcohol. So for that first 7 to 10 days, people can be in varying stages of being asleep for long periods of time, or if they've come in just simply because they know they want to do something about it, they may be up and about from the start. So it really depends on how they've come in.
I think people underestimate the physical craving that people have and the side effects from being without alcohol, and it's very, very difficult for people to keep off alcohol under those circumstances. If you know that having a couple of drinks will make you feel better, it's very difficult not to do it. So our plan is to keep her here until she's feeling physically secure, and there's a good aftercare plan.
I'm quite happy to be cocooned here. I just feel as though there's no pressures of any sort. Obviously missing my family, but other than that, it's just such a nice atmosphere to be in. Very comfortable. I've had to get extra medication both nights so far. I've just been waking up sort of 3-4 o'clock and shaking and not being able to get back to sleep, so I've had to call down and add some more medication.
And you haven't got much of a tremor?
Not at the moment. I mean, I've had some more medication at 3 o'clock this morning and at breakfast, so at the moment it's under control.
And no craving, you say?
No, not at all. I think the main difference is that I can't just jump in my car. If I was to fancy a drink, I can't just jump in my car and nip down the road. And also, at this stage, I don't want to do that either. Whereas I think this is as far as I've ever come for not wanting to do that. Yeah, I'm certainly feeling like I'm making progress, even though it's only been sort of 1.5 days, I do.
Her detox symptoms are much less than I would have expected, but they're being helped a lot by the medication, so that's good news. With withdrawal from alcohol, you do need to get the medication right, and seem to have hit it right to start with, so that's good news. It is a bit of a black art trying to get the dosage right. I mean, we've got plenty of practice at detoxing patients because it's a common problem, but the dose does vary hugely from patient to patient and really needs reviewing more or less on a daily basis.
What we're trying to do is to keep everybody very comfortable so that they don't get the shakes, the sweats, the nightmares, the night terrors, and all those sort of unpleasant things that people talk about, and seeing things. That's one of the people that things that most people are fearful of.
There's several medications that we use. Quite often use some medication called benzodiazepines, of which diazepam, something most people have heard of. And we use that because it's you use that instead of the alcohol, so it has what's called a cross tolerance to alcohol, so that by using that you don't need to drink. It's obviously dangerous if you do drink on top. And that dose can vary enormously, so some people need modest amounts and other people need sort of 10 times the normal dose. So it's something we need to keep an eye on. The other medication she needs is medication just in case she fits. This is an under-recognised side effect of coming off alcohol, and people can have what's called withdrawal fits, and these obviously can be dangerous, so we give her medication for that. And we quite often give people vitamin B tablets as well to help with withdrawal symptoms. And she's also on antidepressants, so she's taking quite a lot.
I know you've been looking at the programme and deciding what you want to come back to. So reassurance, I think, is one of the most important, and also to talk to them and let them know that they're not alone, that there are thousands upon thousands of people who have gone through the same programme, whether it's here or somewhere else. But it is a very common disease, and lots of people come in for treatment. So lots of reassurance. Talking to them about how they're feeling, whether they're comfortable enough, whether their symptoms are of detox are kept at bay, so that they're feeling calm, tranquil, comfortable, and then we would go from there.
The more you get to know patients, the more complex it becomes, and I am concerned about how depressed she may be. Time will tell. How are you feeling with the shakes?
A lot better. Yeah, definitely not as bad as they were.
Still shaking a bit?
Yeah, just a tad.
Oh, you are, aren't you?
Yeah.
Yeah. Do you think you need the medicine reduced, or is it a bit premature?
Well, at the moment it's sort of keeping it at this level, so...
So leave it for the moment, though.
I think so, yeah, if that's okay.
Yeah. How's the craving?
I still haven't craved at all, which is quite amazing.
Are you surprised at how well you're doing?
Yes, I am.
I mean, what would you put that down to?
I can only assume it's a different environment and just not the accessibility. Other than that, I really don't know, because I've never gone more than sort of a couple of days without really needing to drink.
So this is the longest you've been without alcohol for a
yeah,
long time?
yeah, definitely. Yeah.
A teaching group will be about thoughts, feelings, urges for alcohol, perhaps talking about anxiety, which is quite common when you're coming off and you're trying to do something different. So there's a very broad spectrum of things to be taught. And then there's a relapse prevention group, which most of them would start in here 2 or 3 weeks, hopefully, in their stay, but obviously these days people don't always stay that long. So we would get them into the relapse prevention group, because this is a larger group. It's also partly a self-help group, because everybody is talking about how they're feeling, what they've been doing in the week, what's been comfortable, what's not been comfortable. And there's a great deal of support because everybody is at a different stage. So those that have been coming for 3 months, say, are a lot further down the line than those who are starting, and they're actually able to give the newcomers encouragement.
I found that really good, actually. It was similar in a lot of ways to AA insofar as people sort of sharing their experiences, but without all the the side that I didn't like from AA. I got a lot out of it, definitely got a lot out of it, and it was nice sort of hearing people saying about what they were like when they came in and how they're feeling now.
And what sorts of things were they saying?
Very positive things, apart from there was a couple of people who sort of said a few days in, sort of once the medication everything was lowered, they did start craving alcohol again, which was a bit worrying, but other than that, that was probably the only negative thing I got out of it.
In reality, many patients, of course, do need a home detox. There's just so many of them. But in practice, by the time they get referred to psychiatry, it's a bit of an uphill struggle expecting a home detox to be successful.
If people are detoxed at home, there's a danger that they're going to drink on their detox medication because there's not enough support there. There's nobody really to turn to for help. Families may try and help, but sometimes they're the cause of people drinking, and then therefore, you know, something crops up and they just go and have a drink. So I believe it's quite dangerous to detox people at home, and I would like to see many more people detox in hospital.
Why do you need to be here? Why couldn't you be doing this at home?
Because if I was at home, I know I would drink. Here I don't have a choice. I know at this stage I would start drinking again. So, and I don't want to run that risk.
So what's stopping you going out to the pub?
I didn't even realise I could go out. and I wouldn't. I wouldn't, because I want this so much.
I think what's telling is that this is the longest she's been without alcohol for many years, in truth, and she's rather surprised at how well she's done. I think one of the things that we do offer here, which is very important, is the notion of asylum in the old-fashioned sense of the word, which is a place of tranquility. The big step is when she leaves the clinic, and what we need to do between now and then is to devise a treatment plan that will ensure that she continues to make the good progress that she's made. Hello.
Hello.
Tell me what's been happening.
I went back to drinking again a couple of weeks, 2-3 weeks ago. Been getting really sort of down again. And when I started to find it hard, after I'd been out for sort of a couple of weeks, and you know, as everyone tells you happens, you know, sort of that first time I decided I'd have a drink, and it was like gone, you know, half bottle was gone in one go, and sort of started on the slippery slope again. So
relapse is very common. We sort of define it into a few stages. There are people that make a slip, just have one drink, and then perhaps realise that they're heading down the rocky road and do something about it straight away. There's a lapse, which will be more than one drink, but that's also a lapse into the old type of behaviour which people would accuse them of drinking, even perhaps though they hadn't. And then there's a full-blown relapse where they just go back into drinking. And all of those we use as a learning curve for them to help them look and see what they've missed and how they could have done things differently.
Okay, go back a bit then. Tell me about, looking back, how you felt the detox went.
I was very pleased when I left here. I was really happy and I felt different, and that's what's really sort of got to me, I think, is the fact that I did feel so good and I knew I felt so much better. But when it came down to it, I just sort of went back again.
it's not as though I didn't know the risks sort of at the end of the day, you know. Just sort of let everyone down, really.
I'm not that surprised Debbie's relapsed. It is quite common, to be honest. But it does show the value sometimes of having the relatives there. It provides an opportunity to talk to them and explain what's going on. And you then can get them on your side as well.
It's difficult for people when they relapse because what you're asking people to do is to change their habits, change the things that they've used. You know, we all do things in a way where we don't have to think about what we're doing. And one of the examples I give to the patients is cleaning your teeth. If you're right-handed and you always clean your teeth with your right hand, if you break your right hand and you have to use your left, it's extremely difficult to start off with because you can't get the angles right, and I make them practice it. So, but after a little while, when you've been in plaster 6 weeks, you've begun to get the hang of it, and it's actually a lot easier. And that, in effect, is really what coming off drink is about. Things are difficult and complicated at first because you've got to stop and think about what you're doing. And gradually, as they learn, they begin to do things in the new way and they don't have to think quite so much about it. So they're building up on their recovery all the time.
I don't think it's a bad thing that Debbie still feels a bit depressed. After all, that does seem appropriate. You know, she's been in hospital a couple of times and that was disappointing for her. But I think she has a far more realistic view of what the future holds. And in fact, I'm a lot more optimistic than I was when I first met her.
Well, I left on a high last time, maintained that high, but then I started to feel low again and I didn't have anything to back me up. You know, as in there was nothing to stop me going back to my old ways of drinking again. This time I've got that behind me and as far as I'm concerned, I've got that sorted. You know, it's a month today since I had my last drink.
And when people actually can get it together and then they go on to a happy, sociable life, they're feeling comfortable with themselves and their families, then I think that's the biggest bonus that they can have. And I guess that makes us feel good, but it's not good because we've done a good job. It's actually them that have done it, but we've helped them, and I think that's, you know, for them it's been the start of a new life, and that's just remarkable.
Have got much of a tremor?
Not at the moment. Not at the moment. I mean, I've had some more medication at 3 o'clock this morning and at breakfast, so at the moment it's under control.
I was scared, very scared, and I didn't think that it would work.
Right.
I really didn't. I didn't think there was a way out of the way I was feeling. So, yeah, at that stage I was just terrified, and I couldn't imagine my life without drinking. I think that was more scary than anything.
Oh, hello.
Hello.
Tell me what's been happening.
I went back to drinking again a couple of weeks, 2-3 weeks ago. Been getting really sort of down again. I mean, I started to find it hard after I'd been out for sort of a couple of weeks. And, you know, as everyone tells you happens, you know, sort of that first time I decided I'd have a drink and it was like gone, you know, half bottle was gone in one go. And sort of started on the slippery slope again, so. I still think a lot of it's complacency. Got to a stage where I didn't think it was a problem, and you know, that was my way of coping previously, and when things started to get difficult, I started to drink, thinking it was under control, but it very quickly wasn't. For me, yeah. Because it allowed me to get out from the house. All my drinking was done in the house. I never went out to drink. I drank at home. So I needed to get out, be out of that environment. I needed to be away from the pressures, if you like. All the things that would stress me out. And I just needed some time to me, I think, instead of being a mum and a wife. And I just needed to get that time away and just concentrate on myself. So I think it was essential for me. My first thought is how awful I looked. And it just really brings home how much things have changed, how much I've changed, how much better my life is now than it was then. Future, I don't know. There's so many things open to me now. I'm doing courses. Obviously, I don't know what's going to happen relationship-wise, but at the moment I'm more than happy living on my own. Who knows? Future looks a lot brighter for me now. A lot brighter.